Hi, my name is Hong Lee, and I'm going to be covering prenatal teaching for a healthy pregnancy. We will start by entering our patient room, close the door for privacy, perform hand hygiene. Hi, ma'am, I'm Hong. I'll be your nurse today. Can you verify your full name and date of birth? Verify two patient identifiers. Okay, Mrs. Smith, today doctor mentioned that you are newly pregnant. Congratulations. I'd like to go over some information about what to expect with this pregnancy, some tips and tricks to maintain a healthy pregnancy. Is that okay? All right. And this is your first appointment. We're going to be doing a pretty thorough evaluation today. We're going to start by talking about your last menstrual period and we'll calculate your due date. We are going to discuss family history, your medical history, lifestyle questions, and then we will get your blood pressure, your height, and your weight. We're going to do a complete physical exam, including a pelvic exam, a pap smear, and an STD screen. We will also get a blood draw. We will test that to figure out your blood type and positive or negative Rh factor, which comes into play a little bit later. We'll also get a general idea of your health as well as screen you for things like hepatitis B, HIV, syphilis, rubella, and then depending on how far along you are, your doctor may or may not do an ultrasound today. It could be transvaginal, so an internal probe, or kind of standard external belly ultrasound. After this appointment, we will see you once a month until 28 weeks. From 28 weeks to 36 weeks, we will see you every 2 weeks. And then from 36 weeks until delivery, we will see you once a week. At this appointment, we will do your blood pressure, your weight, we will measure your belly or your fundal height, and that just to ensure that the baby is growing as expected. And then we will listen to baby's heart rate and with a Doppler. Some special tests that you can expect around week 20. We will do an anatomy scan, which is just a pretty detailed scan of baby. Make sure everything is forming correctly, and a lot of time you can find out the gender at that appointment if you would like. Usually between week 24 and 28, we will do a glucose tolerance test to check for you for gestational diabetes, and then between weeks 36 and 37, you can expect a group B strep swab, and if that's positive, then you can expect IV antibiotics with delivery just to protect baby from that. For nutrition in pregnancy, you only need about 300 extra calories a day, and that starts about the second trimester, and then just a little bit more than that when you reach third trimester. So it's really about balancing, getting good nutrients and all of your vitamins that you and baby need within your calories. So we want to see a good balance of protein. So in your poultry, fish, eggs, beans are a good source of protein. For carbs, we want to see good whole grains, so brown rice, quinoa, fruit, and veggie. We recommend a variety of colors and types. Your dark green leafy veggie are going to be really great for pregnancy. We also want to see you intake a good balance of healthy fats. So things like avocado, seed, nuts, olive oil, and then your dairy. So like milk, cheese, yogurt. We do want to avoid unpasteurized dairy as well as raw or undercooked meat or eggs, and then alcohol should be avoided. Some supplement and vitamin that we want to be aware with pregnancy is folic acid. Going to be a big one. Our goal is 600 microgram a day of folic acid that helps develop baby neural tube, which turns into the brain and the spinal cord, so very important. You can find that in leafy green and fortified cereal. Other supplement that we will pay attention to is iron that help red blood cell transport oxygen to baby, and then things like your calcium, your vitamin D to ensure strong bones for both you and baby. Your doctor will probably recommend a once a day prenatal vitamin, and so that will help you supplement a good dietary intake. It doesn't make up for a diet, but it will supplement it. And then with pregnancy, hydration is really, really important. We recommend at least 3 liters of water a day during pregnancies. Exercise current recommendation are going to be 150 minutes per day of moderate aerobic activity. So if you haven't exercised recently, we recommend starting a nice and slow with walking, some light aerobic activity, and then working your way up. Some good exercises for pregnancy is swimming, resistance band exercise, and prenatal yoga. If you already have exercise routine, you are safe to continue that as long as there are no risk of falling or abdominal trauma. Weight gain with pregnancy is a little bit of a hot button topic. However, we do expect a healthy weight gain with pregnancy. So our goal weights are based on your pre-pregnancy BMI. So if you have a BMI of less than 18, you would be considered underweight, and we would expect a 28 to 40 pounds total weight gain. Normal weight, so an 18.5 to 24.9 BMI, we expect a 25 to 35 pound total weight gain. Overweight with a BMI of 25 to 29.9, we would expect a 15 to 25 pound weight gain. And then if you have a BMI of over 30, you would be considered obese, and we would expect an 11 to 20 pound total weight gain. Some common pregnancy symptoms you might encounter is going to be nausea, vomiting, morning sickness type symptoms. For that, we recommend small, frequent meals as well as increasing your protein. And then you can add some products with ginger. So like ginger ale, ensure that it actually has ginger, which has been known to help. Also, some other complication is constipation. The hormone release during pregnancy can kind of slow your digestive system, the smooth muscle of your GI tract. So the best thing for that is exercise and get things moving. Also, increasing your fluid and your fiber intake, so you can add things like ground flaxseed or prunes to your diet to help with that. And then another common thing is heartburn or acid reflux. So to help with that is similar to vomiting. Is more frequent meals are going to be ideal. Avoid trigger foods, so usually your spicy food, fried foods, and then avoid eating right before bed. You can try propping yourself up on some pillows or a foam wedge to help gravity kind of keep things down. Some warning sign that if you experience, please call your provider immediately. It would be severe abdominal pain. This could be a sign of ectopic pregnancy, a miscarriage, placental eruption. It could also be a sign of unrelated causes, such as gallstone or appendix. It could be uterine growing pains, but it's definitely important to get that checked out. Also, if you notice any swelling in your face, your hands, your feet, any changes in vision, blurriness, dark spot, or headache, especially severe headaches, they are signs of a preeclampsia, and you need to be checked out. Also, vaginal bleeding. Sometimes vaginal bleeding can be normal in pregnancy. However, it could also be a sign of something serious, again, like miscarriage or placental complications. And so give your doctor a call and get checked out with any vaginal bleeding. Do you have any questions, comments, or concerns? I know that was a lot to take in. Okay, I will check in with your provider, and again, congratulations.